Erectile dysfunction is defined as the persistent inability to achieve or maintain an erection sufficient for satisfactory sexual performance. This can lead to a range of difficulties and frustrations, and can impact a man's quality of life, self-esteem, and relationships. This condition can occur at any age, but it becomes more common as men get older. According to a study published in the Journal of Sexual Medicine, the prevalence of erectile dysfunction in men aged 40 to 70 years is around 52%. However, this number may be underestimated, as many men may not seek medical help for their condition. To understand what exactly happens in erectile dysfunction, first we need to look at normal physiology of erection. Erections are a complex process that involve the coordination of the nervous, vascular, and endocrine systems. The process begins with sexual arousal, which can be initiated by physical or psychological stimulation. As a result of this arousal, brain sends signals to the nerves and penis to release of nitric oxide. Nitric oxide is a chemical messenger that relaxes the smooth muscle cells in the blood vessels of the penis, allowing them to dilate and increase blood flow. As the blood flow to the penis increases, the spongy tissue in the penis, called corpus cavernosum, fills with blood, causing the penis to become erect. Erectile dysfunction occurs when there is a disruption in the normal physiological process of erection. This disruption can be caused by a range of factors, including physical, psychological, or lifestyle. Physical causes of erectile dysfunction can include conditions that affect blood flow to the penis, such as cardiovascular disease, diabetes, high blood pressure, and high cholesterol. According to the American Urological Association, up to 75% of men with diabetes will experience some degree of erectile dysfunction during their lifetime. Other physical causes can include hormonal imbalances, neurological disorders, and the side effects of certain medications. Psychological causes of erectile dysfunction can include anxiety, depression, stress, relationship issues, and performance anxiety. In some cases, psychological factors may be the primary cause of erectile dysfunction, and physical factors may be secondary. Lifestyle factors can also contribute to erectile dysfunction. Smoking, excessive alcohol consumption, and drug use can all increase the risk of developing erectile dysfunction. A study published in the Journal of Sexual Medicine found that men who smoke are at a higher risk of developing erectile dysfunction, with up to 65% of smokers experiencing some degree of erectile dysfunction. Excessive alcohol consumption can also contribute to erectile dysfunction, as it can damage the nerves and blood vessels that control erections. If you are experiencing symptoms of erectile dysfunction, it is important to seek medical advice to diagnose the underlying cause and determine the most appropriate treatment plan. The first step in diagnosing erectile dysfunction is to undergo a medical history and physical exam. Your doctor will ask you about your symptoms and medical history, including any medications you are taking and any underlying health conditions you may have. They will also perform a physical exam to check for any physical abnormalities that may be contributing to your symptoms. In some cases, your doctor may recommend lab tests to help diagnose the underlying cause of erectile dysfunction. These may include blood tests to check for hormonal imbalances, such as low testosterone levels, urine tests to check for diabetes or other underlying health conditions, cholesterol and lipid panel to assess your cardiovascular health. Imaging tests may also be recommended to diagnose the underlying cause of erectile dysfunction. These may include ultrasound to assess blood flow to the penis, magnetic resonance angiography (MRA) to assess blood flow in the pelvic region, computerized tomography (CT scan) to assess for any physical abnormalities in the pelvic region. If your doctor suspects that psychological factors may be contributing to your symptoms, they may recommend a psychological evaluation. This may involve a series of questionnaires or interviews to assess your mental health and any underlying psychological issues that may be contributing to your symptoms. If you have been diagnosed with erectile dysfunction, it is important to understand that there are several treatment options available that can help you manage your symptoms and improve your sexual function. In some cases, making lifestyle changes can help improve erectile dysfunction symptoms. These may include quitting smoking. Smoking can damage blood vessels and reduce blood flow to the penis, making it difficult to achieve or maintain an erection. Reducing alcohol consumption. Excessive alcohol consumption can also damage blood vessels and reduce blood flow to the penis, contributing to erectile dysfunction symptoms. Maintaining a healthy weight. Obesity and being overweight can contribute to erectile dysfunction symptoms by increasing the risk of underlying health conditions, such as diabetes and cardiovascular disease. Exercising regularly. Regular exercise can help improve cardiovascular health and reduce the risk of underlying health conditions that can contribute to erectile dysfunction. There are several medications available that can help improve erectile dysfunction symptoms, including phosphodiesterase type 5 inhibitors. These medications, such as sildenafil Viagra, tadalafil Cialis, and vardenafil Levitra, work by increasing blood flow to the penis, making it easier to achieve and maintain an erection. Alprostadil. This medication is available in the form of an injection, suppository, or cream and works by relaxing blood vessels and increasing blood flow to the penis. Testosterone replacement therapy. Men with low testosterone levels may benefit from testosterone replacement therapy, which can improve sexual function and libido. It is important to note that these medications should only be used under the guidance of a healthcare provider and may not be suitable for everyone. Your healthcare provider will work with you to determine the most appropriate medication and dosage based on your individual needs and medical history. Vacuum erection devices. Vacuum erection devices (VEDs) are devices that can be used to create a vacuum around the penis, drawing blood into the penis and helping to achieve an erection. VEDs can be an effective treatment option for some men with erectile dysfunction and are often used in combination with other treatments. Surgery. In some cases, surgery may be recommended to address underlying physical abnormalities that are contributing to erectile dysfunction symptoms. This may include penile implants. Inflatable or semi-rigid devices can be surgically implanted in the penis to help achieve and maintain an erection. Vascular surgery. Surgery may be recommended to repair or replace damaged blood vessels in the penis that are contributing to erectile dysfunction symptoms. It is important to note that surgery is typically only recommended in severe cases of erectile dysfunction that are not responsive to other treatments. Hope you have liked this video. Please support us by subscribing to our channel.